Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to be talking to you about innovative treatment options for cervical disc herniations. We're going to provide you with some great information, so please stay tuned. Okay, so we've been seeing a lot of patients coming into the office with lower back disc herniations and certainly cervical or neck herniations. And in our clinic, we've got a really unique treatment perspective for this, and we can really help manage those without surgery or long-term pain medication, right?
Absolutely. We think about disc herniations in relation to the disc material. It's very similar and it's kind of the same for the most part throughout the whole spine. But the spaces are much tighter in the neck, and we want to really maintain movement because those joint spaces are tight on the nerves. There's a spinal cord that sits there that isn't present in the lower back. So we really have to be kind of more concerning about the way discs involve the neck.
Right. And so the typical presentation, you'll have somebody that presents with, the neck pain that goes down into either arm. And with our team approach, where we've combined medical care, chiropractic treatment, and physical therapy, we can really look at the patient at all angles and offer them in-house treatment. Oftentimes patients think about going to the chiropractor, and that's the last thing they want to do when they're super acute, to have somebody tugging on their neck, especially when it's flared up. But we have this specialized technology in the practice where we have the Cox decompression tables where we can treat cervical spine. It's under the doctor's control. It's a nice smooth movement, and we're able to incorporate all of the ranges of motion without flaring the patient up.
That's so important because because those spaces are tighter in the neck, we want to constantly have a medical evaluation. We constantly want to have assessments by the adjustments of chiropractic that's gentle, as you mentioned. We want to make sure that the strength in the arms are really being evaluated. And we have so common reasons for numbness in our hands, for like maybe carpal tunnel things, but we have to really make sure that neurologically it's not coming from the neck. So we really want to just be cautious in that acute stage and then really kind of progress them with our services.
And when the patient presents acute, obviously in a lot of pain, we always think holistically, so we can incorporate, class 4 laser works really good, helping reduce the inflammation, controlling pain a little bit. We do those intramuscular trigger point injections, so when those muscles are guarding, it helps to loosen it up, and we use a natural product called Cervical, so unlike cortisone, it's not going to be harmful for you. But if the patient is in a lot of pain, you're our medical director, so you have the ability to prescribe some short-term pain medication to help the patient along.
And again, for the neck, we want to calm that nerve down a little bit more quickly, so we do get maybe some steroids sometimes early on, or just a high dose of ibuprofen products or anti-inflammatories. But again, I'm going to look back to get those x-rays of the neck, maybe an MRI sooner in the case of a neck. We really want to make sure we're looking at that structure before we start all this treatment. But once we have that data and information, then we can really incorporate all these services that we have.
Right, and we can send a patient home with a cervical collar, and once things stabilize, we get them on Colleen's schedule. My wife, she's our physical therapist, then work on a long-term approach of stabilizing the neck, working on their posture, improving their strength and range of motion. And then also too, for those patients that have more of an arthritic component, we have those regenerative medicine injections where we combine the Morton's jelly allograft or stem cell injection with the platelet-rich plasma to help to repair damage to the joint. So really, if you think about it, if you have a disc herniation in the neck and your doctor has talked to you about, we need to send you to the neurosurgeon, you certainly want to make an appointment with Dr. Marciello so he can give you a second opinion to make sure that you have all of the conservative options.
And we're thinking of necks really as a long-term issue. We don't like to see people just go to get a treatment, get an injection somewhere, and then they feel like, they're okay. A cervical disc herniation really is going to live with someone for a long time. We are looking at those degenerative changes in the long term, reassessments periodically, getting into long-term treatments of those injections that you mentioned. The regenerative injections really are not harmful, they're actually helpful for the longer term.
Absolutely.
And so that's why we're trying to just make sure that person is being looked at now acutely, subacutely, and long term. all very important with neck issues.
And don't forget, those regenerative medicine injections are covered by Medicare. So if you'd like more information about our practice, just check out our website at maragalmedical.com.